Good afternoon. I am Dr. Alim Akhtar Bhuiyan. I am Senior Consultant Neurologist and Coordinator at Evercare Hospital, Dhaka. Actually, Evercare Hospital, Dhaka has been named as Apollo Hospital, Dhaka earlier. Today, I'll be discussing on one of the important neurological disease that is called Bell's palsy. Actually, Bell's palsy is a disease of one of the cranial nerve. It is actually the seventh cranial nerve, and the Bell's palsy happens most of the time without any reason. And this is a disease which improves over several weeks. We have to give certain treatment. I'll discuss on that later. Actually, if you look at the anatomy of the brain is composed of billions of cells, and the different portions of the brain performs different function. The cognitive function, the motor area, sensory area, the walking, balance, smelling, taste, hearing, urine control, etc. All these are controlled by different portions of the brain. And the brain again is composed of cerebral cortex, and then we have the basal ganglia and the brainstem. Brainstem has midbrain, pons and medulla, which continues as the spinal cord through the foramen magnum. And the different cranial nerves, which are exactly 12 pairs of cranial nerve, they come out of the brain and perform different function. Number one cranial nerve is olfactory nerve. It helps in smelling or olfaction. Similarly, nerve 2, that is the optic nerve, helps in our vision. Similarly, the seventh cranial nerve is the facial nerve. It controls different function of the muscles of facial expression. So if this nerve is affected, which is mostly on one side, it is called facial palsy. And a specific type of facial palsy, which is mostly idiopathic or viral, it is called Bell's palsy. So before going into the sign symptoms, we should know what the seventh cranial nerve is doing. So it controls the function of the muscles of facial expression, like we are wrinkling our forehead. This is done by the facial nerve, like closing the eyes forcibly, which is through orbicularis oculi, which is supplied by the facial nerve. Like when you get angry, frowning, this is also controlled by the facial nerve. Like we are moving our muscles of facial expression, movement of the face on one side or the other is also controlled by facial nerve. The way we are eating, it is also helped by the facial nerve. Like we are also whistling, doing like this. This is also controlled by the facial nerve. Like smiling, this muscle, facial muscle, is controlling our muscles, controlling our smiling. So different portions of the muscles of facial expression helps in this. Like we are puffing our facial muscle, taking air and keeping it inside, it is also helped by the facial muscle. Similarly, one of the branches from the facial nerve goes into the middle ear, and it is called nerve to the stapedius. If that nerve is affected, we hear the sounds louder or abnormal sound. And one of the branches from the facial nerve, it supplies anterior 2/3 of the tongue. So if that is affected, we have distaste for food. So depending on the nerve involved, we have different symptoms. So if somebody is affected by a Bell's palsy, he cannot wrinkle the forehead, he cannot close the eyes forcibly, he cannot frown, and he cannot smile. One side of the face will be flat and will not move. When he is eating, the one side of the face cannot move, so some of the food will be stuck in between the gum, teeth, and the facial muscle inside, so he cannot move properly. But they don't normally have problem with swallowing. So, and as I mentioned earlier, they can have problem with the loud voice. Taste can be affected depending on the nerve affected. And this facial nerve, it comes from the brain through a canal in the skull that is called the facial canal, and in front of the ear it branches into different portions. One is supplying the forehead, one here in the face, one is down, and one is along the mandibular area, and one part, as I mentioned earlier, to the tongue, one part is supplying the ear. So depending on the part affected, we have different kind of signs, symptoms. So when the disease starts, sometimes patient can have mild headache or pain in the post-auricular area, and mostly the facial pain is not there, and it can happen maybe one day or earlier before the symptom happens, and patient can have the symptom one day earlier, and next day in the morning he might wake up with face which is affected, and in 2 to 3 days he develops the full symptoms of Bell's palsy. Who gets the Bell's palsy? Actually, male and female both are affected by this disease, and people from 15 to 60 years of age, they can be affected by Bell's palsy. 1 in 60 people can have a Bell's palsy at some part of their life. So what causes the Bell's palsy? So most of the time we don't find any reason for the Bell's palsy. It is because sometime of immunologically mediated disease, or it can be due to viruses. Sometimes the herpes simplex virus or herpes zoster virus, that is the chickenpox virus, can involve the nerve when it is exiting from the brain through in the facial canal, and cause inflammation of the nerve and cause the facial paralysis on one side. Sometimes these viruses, once somebody is affected by this virus in the earlier age, after few months or years, when the virus remains dormant in the nerve, it can reactivate under certain circumstances and cause the Bell's palsy. People who have diabetes, or a pregnant lady, or somewhat immunocompromised, they can develop the Bell's palsy later. And most of the time, as I mentioned earlier, Bell's palsy is unilateral, that is one side is affected. Normally we don't get Bell's palsy on both sides together. Maybe it can happen on one side, maybe months or years later it can affect the other side, but simultaneously affecting the right and left side is extremely unusual. Sometimes we can get facial paralysis on both sides. It is not called Bell's palsy, it is because of some other neurological disease. It can be due to Guillain-Barré syndrome, it can be due to sarcoidosis, Lyme disease, which is a tick-borne disease found in Connecticut in USA. It can be because of facioscapulohumeral dystrophy, myasthenia gravis, etc., when both sides of the facial nerves are affected. Sometimes, so when you say facial palsy, one specific type is Bell's palsy, but the facial nerve weakness can be due to some other reason also, like head injury, or patient having sarcoidosis or Lyme disease, as I mentioned earlier, and it can be because of growth in the ear, or it can be because of parotid gland tumors, or sometimes the tumor in the brain can grow slowly and also can cause facial nerve paralysis. So even in stroke we get facial paralysis, but that is different. In the stroke we have facial paralysis on one side, the lower part of the will be affected, the wrinkling will be there, so it is upper motor type of facial nerve palsy. In Bell's palsy, it is lower part when the whole side is affected. In a stroke, it is only the lower portion, not the forehead. And sometimes stroke can cause this. And in a stroke, we don't have only facial paralysis. We can have other symptoms like dysarthria, slurred speech, dysphagia, paralysis on one side, or sensory symptom, eye symptom, gait imbalance. So in stroke, if somebody has facial weakness, he should have other symptoms, not only facial paralysis. That's how you can differentiate. Sometimes patients with brain tumor, which is very slowly growing, it can develop over weeks or months. Patient will have other symptoms besides facial paralysis. He can have headache, dizziness, lightheadedness, visual disturbance. He can have gait imbalance, paralysis, or problem with cognition. So different symptom along with facial paralysis. So if we take a whole history, we can say whether it is Bell's palsy or some other disease when the treatment and management totally differs. So how the disease progresses. So it is, once it is diagnosed, we have to start the treatment immediately within 72 hours. The delay we do more, the chance of recovery becomes low. And so as soon as the treatment is started, it is much better. So, and the recovery 2 to 3 months it can happen, and a lot of times we have complete recovery. But in some cases, even after 1 year, patient can have mild residual weakness of the facial nerve on one side, which is not very much noticeable, and it is not life-threatening or serious. Sometimes patient after recovery, he can have hemifacial spasm. The muscles, they have myoclonic jerk or jumps that can be treated with some medicine or injection botox. So once somebody has Bell's palsy, it should be diagnosed immediately, and the treatment portion is later. Diagnosis is by the history from the patient and examination, and we take the history to rule out other causes of facial paralysis. So once everything is excluded, then we come to the conclusion that this is Bell's palsy, not something else like brain tumor or stroke or Lyme disease, sarcoid, and other disease which can cause facial paralysis. So once the diagnosis is established, then most of the time the doctor, preferably a neurologist, he starts the treatment immediately. He does not need any test as such. But if he's thinking of some other reason besides Bell's palsy, he can order for basic blood test like CBC with ESR. He can order for ANA or CRP or fasting blood sugar to make sure there are other no reasons for Bell's palsy. So is neuroimaging essential like CT scan or MRI? If it is plain Bell's palsy, we don't need any neuroimaging studies. But if the doctor or neurologist thinks there could be other reasons, as I mentioned earlier, brain tumor, stroke, some other rheumatological disease, he might ask for a neuroimaging study, preferably an MRI. So how we treat this condition? Once the diagnosis is made, we have to start the treatment as soon as possible. It is done by oral steroid. We start prednisolone, and it is given for 8 to 10 days. Sometimes we give a fixed dose, or sometimes we can give a tapering dose. And with the steroid, we can give GI prophylaxis medicine, and in addition, we can give antiviral drugs for 5 to 7 days. There are different antiviral drugs. It helps in the healing of the facial weakness. So this is the way we can start the treatment. Besides this, we can give some facial exercises facial muscle exercises to improve the neurological deficit, and also patient can have better recovery if he is getting physiotherapy treatment. So it helps in the better recovery and improvement. So if you look at the link below, I have attached some videos on how to do the exercises, and also link a video showing how to do the physical therapy. Also, I have enclosed a video of the facial nerve, picture of a facial nerve. So overall, the improvement happens in weeks, maybe 2 to 3 weeks, and in after 3 months or so, most of the time it improves. But initial improvement is faster, and then it slows down. So another important part is the eye protection. As I mentioned, when the Bell's palsy happens, patient have difficulty in closing the eyes, and so once they close their eyes, it cannot. The eyelids, they don't come closer. Sometimes the cornea, the whitish part of the eye, can be seen from outside, even if the eye closes. So this makes the eye vulnerable for exposure keratitis or conjunctivitis, which should be prevented. So patient during this time should wear a eyeglass or sunglass to protect the eye, and eye drops are sometimes applied to the affected eye in tear sol or artificial tear to keep the eye moist so that it does not get infected. Sometimes antibacterial eye ointment can be put into the eyes at night to prevent any infection. So these are the few measures which will protect the eye from any further problem. So once patient gets all the symptoms, slowly he improves, and these are the conservative management which helps in the recovery of the facial weakness. The question is whether it will happen again. Most of the time it is monophasic, that means it doesn't come back again. But 1 in 14 people can have this disease even months or years later, which is not very common. And if somebody has recurrent Bell's palsy, that we should investigate why patient is having recurrent infection, whether there is any space occupying lesion in the brain, or is having recurrent herpes infection. And lot of times we prescribe long-term antiviral drugs, and if there is an SOL inside the brain, we have to deal accordingly. So this is the description of Bell's palsy. I think this discussion will help our patients, their attendants, and also the doctors to deal with this important disease. Thank you.